This video is an overview of healthcare reform that occurred in 2010, what's commonly called Obamacare, or the Patient Protection and Affordable Care Act is the full name. We typically just call it the Affordable Care Act, and that's what I'll refer to it as we go through this video. So the goals for healthcare reform were to A, expand health insurance coverage to those people who did not have health insurance coverage in the United States. Also to provide better coverage for those people who did have insurance at that time. And also to improve the access to and the quality of the care for individuals by providing more services. And also, one of the biggest problems is rising healthcare costs. So there were a number of measures put into action in order to be able to avoid the huge spikes in healthcare costs that we'd seen in the 1990s and the early decade of the 21st century. So really, there are a number of different ways of understanding what the Affordable Care Act did, and it was a very complex measure. Some people now are talking about a single payer system in which there would be one program. The federal government would provide insurance and that would pay for everything. That was not in 2009, 2010 during the deliberations on this. It was not really an option that was on the table. What we saw was that there were a number of different ways that the government went about trying to expand access to healthcare coverage. So on the one hand, you had employer-sponsored coverage. So there were tax incentives for businesses that did not provide health insurance to get their employees insured. Second of all, they expanded Medicaid to poor people that were just above the poverty line. So Medicaid coverage was lifted from people that were 100% at the 100% level of the poverty line to 133% of the poverty line. And through a complicated formula that we don't need to get into, it really actually ended up being people that are up to 138% of the federal poverty line are eligible for Medicaid expansion. Again, that program run through the states for poor people. So it extended that program. And then finally, each state was tasked with coming up with a healthcare exchange. And if they didn't want to come up with a healthcare exchange, there was a national exchange. And this provided subsidies for people that were above the 133% of the federal poverty line up to about 400%, whereby the federal government would provide tax incentives or subsidies for you to be able to go out onto these exchanges and purchase your own health care. And as you got closer to that 400%, some of the subsidies phase out, but the goal was to get these people that were right, up into the middle class, the ability to be able to get health insurance. Now, there are a couple of things that are important here. One was that, very similar to the way we have mandates for car insurance, there was an individual mandate placed on this in order to be able to require people to have healthcare coverage or else face a fine. The fine would have been about $600. What's interesting about this was that we'll see in a couple of minutes that the healthcare industry was willing to go along with covering everybody, but they also wanted to make sure that healthy people also got health insurance, because that way they could help to pay for the people that were not healthy. Now, what we've seen is with the Healthcare Reform, Tax Reform Act of 2017, Republicans and President Trump have repealed that individual mandate so that you're no longer legally required to have health insurance in the United States. And that's just one of the things that has kind of come crashing down for the Affordable Care Act. The second thing is this Medicaid coverage expanding from 100 to 133%. As the Affordable Care Act was originally written, states, if they did not expand to 133%, would have lost all their funding for Medicaid. And Medicaid is actually, after education, one of the top one or two things that is in a state government budget. So it's an enormous amount of money. And the Supreme Court in National Federation of Independent Businesses versus Sebelius basically said that this was unconstitutional, that they were forcing, but the ACA would have forced states to have lost too much money if they decided not to really go along with expansion. So the states really didn't have a choice. They were being coerced into expanding Medicaid, and that was unconstitutional. So what we saw then was that there's a hodgepodge of states that have adopted the expanded Medicaid coverage and some that haven't. I'll talk about that in a minute. So two big things. One, the end of the individual mandate. And second of all, the expanded Medicaid coverage is now optional. So a couple of other things about improving health insurance. One of the big things was that oftentimes insurers were unwilling to insure people that had chronic pre-existing conditions because they obviously would be a drain on financial resources. As I mentioned, the health insurance industry was okay to go along with expanding healthcare and covering sick people because with the individual mandate, everybody would have been forced to have insurance. There are a lot of particularly younger people who don't kind of take a bet on the fact that they won't get sick and don't have health insurance, but with the mandate, they would have been forced to pay into the system and it would have helped the health insurance systems. The other thing is lifetime caps were removed. There had been caps of perhaps $1 million after which the insurance wouldn't cover you anymore. That was removed. Another thing that was put out there was that if you're 26 or over or under, you would be able to stay on your parents' health insurance. So that was also a very, a big thing. So these pre-existing conditions were a very difficult thing for people that were searching for health insurance, and that made a big difference for them. A couple of other things is, improving the actual benefits of health insurance. There are a whole category of medications and other services that were now provided under the Affordable Care Act by your health insurance company at no cost to you. And the idea is that by sponsoring those preventative services, in the long run, you'll save money because people will be healthier because they've taken those preventative services, even though in the short term, it's going to cost more money. There are also a number of levels of benefit standards whereby each plan in the United States had to provide certain it's kind of stopgap plans with benefits, and also limited out-of-pocket expenses for some consumers. So what did this end up doing? Well, the Affordable Care Act, here you can see, again, was passed in 2010. And, we tend to have a higher uninsured rate when we're in bad economic times, which we certainly were in 2008 and 2009 during the Great Recession. So we were up at around almost 16% uninsured in the United States. But you see this kind of more or less precipitous drop after that to the point where now we are at about 9.1% uninsured in the United States. So while this has not alleviated the problem of uninsured people, and it's not actually led to universal health care where everybody's got insurance, it has knocked off a good 5 or 6% of the people that are uninsured in the United States. Now, as we take a look around the country, we see that there's no uniform measure. While we take a look at 9.1% of the uninsured in the United States, you can take a look around the country and see that there's great disparities. It's about 6% in Pennsylvania, but you got a lot of southern states. Texas is one of them, where almost 20% of people in Texas do not have insurance. So it varies greatly across the country. And one of the things that we can look at is that some of this has to do, although not all of it, some of it has to do with that NFB versus Sebelius decision, which allowed the states to decide whether or not they wanted to expand Medicaid. So since we've had that, more than, I think, 34 states have decided to expand Medicaid. and provide services for people up to 133% of the poverty level. But as you see here, a number of states, particularly southern states and particularly states that happen to be Republican, have decided not to expand Medicaid, and that's been a political decision. We had a very interesting situation happen in Pennsylvania. The Affordable Care Act was passed while Tom Corbett was governor of Pennsylvania, and he was a Republican who didn't, as many Republican governors did not support expansion of Medicaid, but he negotiated with the Obama administration for something called Healthy PA, whereby the private market would provide insurance for people. But as soon as Tom Wolf became governor in 2015, he was a Democrat. He did away with Healthy PA and expanded Medicaid in the state of Pennsylvania. It's not to say that all Republican governors decided not to do that. If you take a look at the two states bordering Pennsylvania, in Ohio, Governor John Kasich expanded Medicaid, as did Governor Chris Christie, who was a Republican at that point in time in New Jersey. So it wasn't all Republican governors, but there was some ideological bent to this. Now, if we take a look at these charts as to who's got the highest number of uninsured in the country, you also see that there are some serious correlations between those states that decided not to expand Medicaid and those states that have the highest level of uninsured citizens within the confines of their state. Again, these are political decisions going forward. What has happened in some states, you see Nebraska here as of 2020, is now in the process of expanding Medicaid. Sometimes in states that were originally run by Republicans that now have Democratic governors, they have expanded even if they might be a quote unquote red state. So that's an overview, very brief, of the Affordable Care Act, commonly known as Obamacare.